Okay.
Health is harmony.
Health is a journey.
Equity.
Happiness
is a spectrum.
is dynamic.
is wholeness.
Is dignity.
ಸಾಮಾಜಿಕವಾಗಿ ಆರ್ಥಿಕವಾಗಿ ಸದೃಢನಾಗಿದ್ರೆ ಅದರ ನಾವು ಆರೋಗ್ಯ ಅಂತ ಕರಿತೀವಿ.
It's a continuum. It changes every now and then.
Much more than getting a medicine.
Social, mental, and all forms of well-being. And so it may vary for you and me.
Harmony with the body, harmony with the environment, and also with the different relationships. Do you feel harmonious?
I feel that I have not done enough. Little sad because I could have done much more. Yeah.
You need to be the right patient with the right disease in the right hospital and meet the right doctor at the right time to get cured.
Everyone talks of health, but what is public health?
Public health is a reflection of society.
It involves access to public transport, it involves access to clean air, clean water, sanitation. Provide not just tablets for the diabetic, but also care for the person with depression.
Way of being.
Being together.
The important thing in public health is the public part of it. A public health professional is responsible for the health of a community. And the key word here is they are responsible for the health. Poor health of a neighborhood, of a family or a society affects everyone in that family, in that neighborhood, in that society.
ಅಲ್ಲಿ ಇಂಡಿವಿಜುವಲ್ ಒಬ್ಬೊಬ್ಬರನ್ನ ಹ್ಯಾಂಡಲ್ ಮಾಡೋದು ಅಂತಲ್ಲ.
It is not just I run a program and it is over. Does my program improve the health of the people?
Very few have the courage to pause at that level and ask themselves, are we relevant? Are we really doing what we started out to do?
Every year, like a pilgrimage, we used to go to Kerala, and my cousin, one night he suddenly developed seizures. By the time early morning we managed to get to the hospital, he was dead. And that really shook me. At the age of 11, I started thinking, my cousin Kannan, from the same family, but he doesn't have access to healthcare, whereas I, sitting in Calcutta, can just walk down and go to a doctor's chamber at any time. I made that promise that I will become a doctor and I'll work in a rural area where there is a need. Rupa was there with me throughout. We walked hand in hand.
At IPH, the leadership has actually been built on the backs of many key people. While Deva and his team of well-wishers, volunteers, friends did help in starting this journey, the next director, Upen,
Deva, who generously offered me to join IPH.
And since then, he has handed it over to Prashant, who is the current director, and also my partner.
He's quite self-effacing. Despite of being in power, has the intent mainly to serve people around.
His style of leadership was also very much informal and unstructured, and so you never knew which was a learning moment with Deva.
I thought of it as a small entity, but yeah, over the time it has really grown big.
And I believe we are close to 100 now.
IPH has now spent 20 years in the field, working with the government in providing ways to see how we can provide responsive healthcare at the grassroots to people in remote areas such as Chamrajnagar, which is one of the forested districts of Karnataka. In our 20th year at IPH, we are organizing our work across 3 centers and 1 school.
We have project offices in BR Hills and Hanur as well.
So there's the Center for Commercial Determinants of Health.
It's about the commodities we consume. It's about what commercial entities do. And it's about the broader economic structures. For example, use of tobacco.
Institute of Public Health has been in the forefront and in building the capacity for implementation of tobacco control.
ಕುಡಿತ ಮತ್ತು ತಂಬಾಕು ಸೇವನೆಯನ್ನು ಬಿಡಿಸುವುದಕ್ಕೆ IPH ಸಂಸ್ಥೆಯವರು ತುಂಬ ಸಪೋರ್ಟಿಂಗ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ.
Then you have the Center for Health Systems.
We want to nurture individuals, researchers to use innovative methodology.
How
The wider systems around health can be strengthened as opposed to addressing only diseases.
Oral health, maternal health, mental health, and urban health. So these are the few of the themes that we have organized ourselves.
Then you have the Center of Adivasi Health.
We have nearly 40 team members, most of whom come from the Solika community. Create a platform where policymakers, implementers, researchers, and Adivasi leaders themselves are able to come together at a table and sit together.
Definitely will be an example for future implementation research projects.
And finally, we have the T.T. Narasimhan School of Advanced Studies.
Through the school, we aim to really filling the gaps in between the mainstream courses that are available. This school is mainly for postmaster students, doctoral students, and lifelong learners who are interested in taking forward the discourse on public health.
ಯಾವುದೇ ಟ್ರೈನಿಂಗ್ ಆಗಲಿ ನಾವು ಜನಗಳಿಗೆ ಬಂದು ಅವ್ರಿಗೆ ಅರಿವು ಮೂಡಿಸ್ತೀವಿ. ಈ ಥರ ಟ್ರೈನಿಂಗ್ ಆಗೈತೆ ನಮಗೆ.
For us, the School of Advanced Studies is a coming together of 2 decades of work and really building a school that can bring together
Grassroots, policy, advocacy, and research. I think conflict is a part of any organization where people are speaking their minds.
And a lot of agreements, disagreements.
Agree to disagree and keep working on the common goal.
Now today it's actually seeing fruition.
Through this dissent, disagreements, etc., that a very beautiful, mature organization has emerged. I think tension has always been constant and we cannot get comfortable.
Cannot shy away from addressing other societal issues.
Our Indian health system is a mess.
Things are messy, but it's how we deal with this and how we tackle it.
So none of us at IPH have an illusion that we are some sort of an exceptional institute.
So I see women at the workplace constantly apologizing.
I don't see gender as a silo to fight for separately. Right? So there are many things that women take as part of their
I have always brought my whole self to work in all the different phases in my journey.
Right from Deva, most of the colleagues would usually chip in to help me with childcare.
Women in the public health sector are yet to get their due.
Who are Ashas? They're all women.
They are working under the harshest of circumstances as frontline health workers.
How do we work towards equitably enhancing health outcomes in our communities, in our societies?
Privilege is something that you don't realize you have until you see someone who doesn't have it.
health is very personal as much as it is political.
We need to make policies which are highly resilient and also they should be agile.
No policy can be perfect from the start. It requires several iterations.
A single policy for a nation of 1.4 billion people would really serve the optics of the policy making, but it would not bring the desired outcome that is required for this particular policy when it hits the ground.
We are trying our best to bridge the research that we do
and the lived experiences of people. Center for Health Systems worked on preparing SOPs, IECs for Griha Arogya. We are evaluating a national health program.
ಆಯುಷ್ಮಾನ್ ಆರೋಗ್ಯ ಮಂದಿರಗಳ ಬಗ್ಗೆ ಮಾಡ್ತಿರಲ್ಲ, ಅದೇ ಒಂದು ಇಷ್ಟ. 12 ಪ್ಯಾಕೇಜಸ್ ಆಫ್ ಸರ್ವಿಸಸ್ಸು ಆಯುಷ್ಮಾನ್ ಆರೋಗ್ಯ ಮಂದಿರ ಅನ್ನೋ ಕಾನ್ಸೆಪ್ಟ್ ಬಂದಿದ್ದೇನೆ.
They have got around 5-6 programs in our district, like Impact NCD they have got, and then they are doing one program in dental health care.
ಅದರಲ್ಲಿ ಎಲ್ಲ ಶಾಲಾ ಮಕ್ಕಳಿಗೆ, ವಯಸ್ಸಾದವ್ರಿಗೆ ಹಾಗೂ ಇನ್ನಿತರರಿಗೂ ಸಹ ಅವರು ಬೆಳಿಗ್ಗೆಯಿಂದ ಸಂಜೆ ತನಕ ಉತ್ತಮವಾದ ಸೇವೆಯನ್ನು ಕೊಟ್ಟು
They have been providing healthcare camps for sickle cell patients, and then we recently have taken up Equip HWC.
We got a better understanding like how the NCD screening activities should be done.
ಹಾಗಾಗಿ ಚಾಮರಾಜನಗರ ಜಿಲ್ಲೆಯಲ್ಲಿ ಏನು ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ನಡೆಸ್ತಾ ಇದೆ, ಅದು ಇವತ್ತಿನ ದಿನಕ್ಕೆ ನಮಗೆ ಸಹಕಾರಿಯಾಗಿದೆ.
Tribal Health Navigator is a program
allows for questioning on the kind of services that they get, the kind of care that they get, and the way people are treated within these hospital spaces.
ಸಮುದಾಯದವರನ್ನ ಆರೋಗ್ಯ ಇಲಾಖೆಯ ಮೂಲಕ ಹಾಗೂ ಪರಿಶಿಷ್ಟ ವರ್ಗಗಳ ಕಲ್ಯಾಣ ಇಲಾಖೆಯ ಮೂಲಕ ನಾವು ಅವರನ್ನ ರೀಚ್ ಆಗೋದಕ್ಕೆ ಒಂದು ಅತ್ಯಂತ ಪ್ರಮುಖವಾದಂತಹ ಒಂದು ಕೋಆರ್ಡಿನೇಟ್ ಮಾಡುವಂತಹ ಕೆಲಸವನ್ನ IPH ಮಾಡ್ತಾ ಇದೆ.
1400 odd Adivasi people have benefited from the navigation provided by the Tribal Health Navigator program.
ಜೊತೆಗೆ ನಮಗೆ ಜಿಲ್ಲಾ ಆಸ್ಪತ್ರೆ ತಾಲೂಕು ಹಾಸ್ಪಿಟ್ಲ್ಗಳಲ್ಲಿ ನಮಗೆ ನಮ್ಮ ಜನರಿಗೆ ಏನು ಸೌಲಭ್ಯಗಳು ಬೇಕೋ ಅದನ್ನೆಲ್ಲ ಸೌಲಭ್ಯಗಳನ್ನ ನಮ್ಮ ಆದಿವಾಸಿ ನೇವಿಗೇಟರ್ಸ್ಗಳಿಂದ ಸಪೋರ್ಟ್ ಎಲ್ಲ ಮಾಡ್ತಿದ್ದಾರೆ.
People who start struggle to find people who will take that journey together with them.
Throughout for me was getting the right
people.
Then it's possible for things to go forward.
The community was the core.
Why is it that I'm stuck to IPH for now over 18 years?
Work culture is a defining feature of the institute, I should say. We have a work culture where the communication is respectful.
And there was a way of encouraging young voices, new voices, and bringing them and helping them get louder and enter the public health space.
Some call it passion, some call it humility, energy, positivity, but there's something that's actively being nurtured here.
I've made lasting friendships here at IPH. Yeah.
There is laughter, there is joy, everybody is involved.
We can do much more, but I'm just praying and hoping that the younger generation has the energy to take it forward and
Be that space which walks with the community.
And also it mentored and trained many younger generation, younger researchers in the country.
When thousands of alumni come out expressing themselves creatively and making meaningful contributions to public health wherever they are globally, that is when I would feel very fulfilled.
We go in the direction of universal health coverage, a healthy India, and a productive India.
This is not an intellectual relationship. This is about harnessing everything together for the good of all.
So who are we? What is our stance?
You have to go, you have to engage with governments, with communities, and figure things out.
If you're not helping the last man down on, the last mile, then what are you doing?
It takes listening, it takes patience.
Their approach, which is very polite and willing to engage and willing to listen and take people to see the facts and evidence themselves.
And it takes trustful collaborations across diverse set of actors.
Now, once you do that, then something explodes. And that is what takes the movement forward.